for either orthotics or if she's having any depression or some sort of way to address the psychosocial aspect of the disorder. Also, we were thinking about referring back to her neurologist or the primary physician, so just updating what's going on with her condition, as well as seeing how she's changing from prior function. Some different equipment we were looking at were orthotics, so helping with stability for standing and ambulation. She currently is demonstrating some weakness in her ankles, so we're thinking about looking at any sort of AFOs and potentially a KAFO if she's really unstable. Some of the home modifications that we could use, again, thinking about wider door frames if she possibly needs a wheelchair eventually, looking at grab bars, anything near or around the tub and toilet, as well as a more accessible ramp that would just be beneficial for her as far as whether she needs a walker or a wheelchair, just something that is a little bit easier than stairs to get up. And then some, again, looking at the assistive or adaptive devices or mobility devices such as a wheelchair. She may start out needing a wheelchair, just a regular manual wheelchair, but again may progress to the power wheelchair or potentially a scooter, which may be beneficial for her for longer distances. One of her goals was to get to the store that was a block away, so using a motorized scooter or wheelchair that may help her conserve her energy but still obtain her goal of getting to the store that's a block away. Some precautions that you want to consider, which I kind of mentioned a couple before, definitely fatigue. You want to avoid fatigue and do not want to work to exhaustion in any sort of interventions that you do. So definitely patient education about that, definitely taking enough breaks. Heat intolerance, so again considering possible aquatic therapy or any interventions at all, just making sure that that core temperature is staying down. That can often lead to exacerbations of the symptoms, and you definitely do not want to cause another flare-up. Checking to see what medications that she's on and some of the side effects. They may produce some flu-like symptoms, and also be careful if she's on long-term corticosteroids. That can definitely affect tendons, ligaments, and joints, as we all know. Again, the cognitive status may also alter some of her decisions, so taking that into consideration when looking at assistive devices so that she is able to proceed safely. So currently how this therapy is different from acute or a home health setting. It's fairly similar. However, the long-term therapy is often focused around maintained function and then controlling the symptoms. So that's different. That home health is usually looking at stabilizing the exacerbation and just getting her back or helping to regain some prior level of function. Some therapy benchmarks that we considered would be significant fatigue levels. So especially the lower extremities, this may lead to a progression in the assistive devices. So she's currently using a walker. This may lead to a manual wheelchair, and then eventually potentially to a power wheelchair or scooter. So just when she's unable to ambulate safely household distances, then we might want to consider that manual wheelchair so that she's able to conserve her energy around the house and still complete her ADLs. Cognitive decline was also another therapy benchmark that we wanted to consider. If if her cognition declines significantly, we also again would have to be aware of that and safety concerns as far as her judgment. So if she's unable to take the correct dosage of medications, if she's not able to be mobile, if she's not paying attention to stairs, or if she's out in the community and isn't paying attention to traffic, these are all big safety concerns. So in that instance, we then would suggest moving Barbara to either an assisted living or skilled nursing facility, again depending on the severity of her cognitive decline. So overall, I'd say the take-home message for any patient with MS in any stage is that you want to consider the fatigue levels. You definitely want to make sure that we're working, but you don't want them to overwork and become exhausted and cause a flare or exacerbate any of their previous symptoms. Everything's going to be extremely individualized. MS is a highly unpredictable disorder that is all going to be completely patient specific, but these are just some guidelines that we can take and use potentially for an outpatient or a long-term care setting with someone with MS. Good luck on your internship, everybody.